Do you know your risk of tetanus as a gardener? National Foundation for Infectious Diseases. Many gardeners are unaware that they face an increased risk for tetanus, a potentially fatal disease caused by bacteria found in dirt, potting soil and manure. According to the 2004 National Gardening Survey, 80% of gardeners say that they get cuts and scrapes while working around the yard, garden or home, which is how tetanus enters the bloodstream. The survey also revealed a general lack of protection among gardeners, with more than 40% reporting that they are not vaccinated against tetanus. The Centers for Disease Control and Prevention recommends a combined booster vaccine known as TT once every 10 years to protect against tetanus and diphtheria, another infectious disease. Every time you work in the dirt you expose yourself to tetanus, so it is important to get your TT booster shot before you dig in, urges National Foundation for Infectious Diseases, NFID, Medical Director Susan Rim, Maryland. Call your doctor today to see if you are due for your 10-year TT vaccine. According to Dr. Rim, tetanus is a very painful disease and can prove challenging to diagnose. In one recent case, a gardener apparently developed a tetanus infection from a bite from a fire ant, but it took more than 2 weeks after symptoms began before this woman learned she had tetanus. During this time, and for several weeks more, this woman was hospitalized and required a tube to help her breath. Among her symptoms, she suffered from severe muscle spasms in her mouth and throat, commonly known as lockjaw. This patient was fortunate to survive her bout with tetanus, as many as 20% of tetanus cases result in death. The disease is especially deadly in immunized persons or those who have not stayed up to date on their TT booster. To learn more about tetanus and diphtheria, or to take a quiz to assess your tetanus risk, visit NFID's website http://worldwideweb.nfid.org.